Unit 14. Symptoms and signs. A. Describing problems. The problems which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what doctors find, also known as findings. On examining the patient, for example, high blood pressure or rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaint, doctor says, Mr. Frank was admitted complaining of chest pain. In case of note, the abbreviation CO is used. CO chest pain. B. Presentation. Patient said they went to see the doctor. Doctor said the patient presented. The symptoms which caused a patient to see a doctor or to present is called presenting symptoms, presenting complaint or presentation. His presenting symptom was chest pain. His presenting complaint was chest pain. He presented to GP with chest pain. The usual presentation is chest pain. C. Talking about symptoms. Symptom meaning patient said. Symptom. Tiredness meaning loss of weight. Patient said, I feel tired all the time. Lethargic, loss of energy, I feel completely worn out. Fatigue, loss of energy. Lately, I've been feeling completely exhausted at the end of the day. Lassitude, malaise, general feeling of being unwell. I feel unwell, I don't feel well. I've been feeling off color for 2 days. I've been feeling myself for a week. I've been out of sort all day. Anorexia, loss of appetite. My appetite is very poor. I've been off my food for days. Weight gain, increase in weight. I've put on 8 kilos in the last year. I've gained 5 kilos. Weight loss, decrease in weight. I'm not eating any less than usual, but I've lost a lot of weight recently. Constipation, hard, infrequent phases. My motions are very hard. I've been quite constipated lately, and not very regular. Unit 15. Blood. A. Full blood count. In the investigation of blood disease, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, white blood cells, and platelets, the volume of cells, the erythrocyte, dissemination rate, ESR, a measurement of how quickly red blood cells fall to the bottom of a sample of the blood. B. Anemia. Anemia is one of the commonest disease of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because of the diet is lacking or deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. What's the most likely that diagnosis in the case? Most probably carcinoma of the bowel with chronic blood loss. Was against that as that diagnosis. Well, he hasn't had any change in his bowel habit or lost weight. What else would you include in the differential diagnosis of severe anemia in a man of this age? He might have leukemia of some sort, or aplastic anemia. But that's right, it would be very usual. Another cause is iron deficiency, but he seems to have an adequate diet. Okay, now there's another cause of anemia which I think is more likely. Chronic bleeding ulcer? Yeah, that's right. But what about pernicious anemia? Can you exclude that? Well, he's got none of the typical neurological symptoms like parasitate. C. Pernicious anemia. Jordi Pons. The medical student from Barcelona has made some languages note in his textbook. Pernicious anemia, PA, is a condition in which 3 is atrophy of the gastric nausea with consequent failure or intrinsic factor production in vitamin B12 malabsorption. The onset is insidious with progressively increased symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of inactive red cells production in the bone marrow. A red sore thumb, leucitis, is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Onset, beginning, insidious, slow developing, pallor, lack of color, mild, slight, jaundice, bilirubinea, breakdown, division into small parts, bone marrow, soft tissues in the cavity of bones, symmetrical, each side is the same, vibration sense, ability to feel vibrations, progressive, continuum to develop, can be palpable, can be felt with the hand. Unit 16. Bones. A. Bones. Some common English names for bones. English name, anatomical name: skull, jawbone, spine, breastbone, rib, collarbone, shoulder blade, thigh bone, kneecap, shin bone. Cranium, mandible, vertical column, sternum, costa, clavicle, scapula, femur, patella, tibia. B. Fractures. A fracture is a break in a bone. Some of the different types of fractures are green stick, displaced, commuted, impacted, open, or compound. Treatment of fractures. When the fragments of a broken bone held and a joint together, they unmute. Union may be promoted or helped by reducing the fracture, replacing the fragments in the anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example a splint or plaster of Paris cast, or internal, for example a pin or a plate and screws. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. Unit 17. Childhood. A. Milestones. Childhood is a period during which a person is a child. It ends with puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestones in a child's development and the ages at which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months, talking by 3 years. B. Common infectious disease. Morbilli, rubella, varicella, infectious parotitis, pertussis, acute laryngitis, scarlatin, rheumatic fever, tetanus, poliomyelitis, measles, measles, chickenpox, mumps, whooping cough, croup, scarlet fever, rheumatic fever, lockjaw, polio.